As this Omicron variant of COVID keeps spreading, an epidemiologist at Vanderbilt is pleading with Tennesseans who are unvaccinated.
He is urging more people to really think about the vaccine status of those who end up in the hospital and how it impacts their symptoms. News Channel 5's Claire Kopsky has the story.
Omicron is spreading, and here in Tennessee, we haven't even hit the peak.
The most alarming thing that we're seeing, and we saw it start in other places of the world, is just a really rapid, precipitous incline in cases. I mean, we haven't seen anything of this magnitude since the beginning of the pandemic.
Epidemiologist Dr. Lauren Lipworth says hospitals are overwhelmed, and almost everyone knows someone who's got it.
It is so highly transmissible. And situations where in the past you might have been able to go to the post office or go to the grocery store and maybe not encounter anybody with COVID, those days have really changed. And so now when you're out in the community, I think Davidson reported last week that 1 in 35 Davidson County residents has COVID. So if you think about the places you go, the likelihood that you're going to encounter active COVID infection is very, very high.
Although the state doesn't keep track of the status of vaccinated and unvaccinated COVID patients, Vanderbilt Health does. At their hospitals in the past week, 293 people were hospitalized. Of those patients, nearly 70% of them were unvaccinated or between doses.
The trends in all the states look very similar in terms of huge, rapid vertical increase in cases, hopefully reaching a peak after a couple of weeks and then starting to come down. What's different, as you say, is that there are different proportions of people in every state vaccinated.
The Tennessee Department of Health reports only 50% of Tennesseans are fully vaccinated, a concern Dr. Lipworth says will likely draw out Omicron in the volunteer state longer than other states.
I hear anecdotally from physicians about patients who are in the hospital and they're young and they're healthy and they're unvaccinated. I don't ever hear about people who are vaccinated or boosted and in the hospital right now with Omicron, other than those who have, immune compromising conditions or serious underlying health conditions.
A reality that she hopes everyone will consider.
Vaccines really do work. They are our best way to get out of this.
In Nashville, Claire Kopsky, News Channel 5.